Primary stability, a cadaver study. The lead author is Amanda Bostoni, fourth-year dental student, and co-authors included Drs. Reed, Bostoni, and Hobbs. The paper has been accepted to be presented at the American Association for Dental Research in a couple of weeks in Tampa.
Good afternoon, everyone. As Dr. Kraut said, I am Amanda Bustani, and I'm here to talk to you all this afternoon about the effect of a modified stepped osteotomy on implant primary stability, a cadaver study. The purpose of our study was to examine the effect of an alternative surgical technique on implant primary stability in Class D4 bone, and differences between insertion torque produced by a conventional surgical placement technique was compared to modified stepped osteotomy comparison. To start, what does all this mean? Well, primary stability is the absence of micromotion at the bone-implant interface at the time of placement. Early motion can damage the tissue and vascular structures surrounding the implant, resulting in formation of scar tissue around the implant. And if you don't have close adaptation of the implanted bone, then you can have failure to obtain primary stability bone and implant without formation of fibrous tissue between the two. So what is the difference between primary stability and osseointegration? Well, primary stability must be achieved before osseointegration can happen. So if you have movement of the implant to begin with, then you have failure to obtain primary stability. And if you have failure to obtain primary stability, then you have failure of osseointegration later. So if we can find a way to measure primary stability, then we may be able to predict implant success and survival rates in Class D4 bone. One acceptable way is to use mechanical analysis with insertion torque drivers. Insertion torque is basically how much force it takes to twist the implant into the bone at the time of placement.